And another one big problem right now in Thailand that I think we have to address is the problem of the infected person concealing their timeline. And this caused a ripple effects into so many things. So the latest information is that 78 nurses from 17 hospitals in Bangkok have had to self-isolate after dealing with COVID-19 infected patients who lied about their recent movements, according to the Confederation of Thai Professional Councils. The president of Thailand's Nursing and Midwifery Council, Tassana Buntong, in her capacity as the president of the Confederation, announced that due to the COVID-19 situation, many medical personnel have been working around the clock, where some of them have contracted the virus. She said that 20 to 30 medics have been infected each day. The high number of medical personnel in quarantine has left many hospitals with staff shortages, resulting in a single medic having to deal with up to 100 patients instead of the usual 20, which Tassana described as a crisis. In the past several weeks, there have been reports from hospitals across the country of infected patients concealing their chronologies. Most recently, a hospital in Nakhon Pathom province has to close its surgical ward for 14 days and isolate 40 medics after dealing with a patient who lied about their recent whereabouts. In Nakhon Si Thammarat, 10 nurses at Maharaj Nakhon Si Thammarat Hospital had to enter quarantine after a COVID-19 infected patient refused to disclose where they have been. And in Khon Kaen province, 105 medics were put in isolation for 14 days after being put at high risk of contracting the virus in similar circumstances. So what are we saying is every time one person concealing their timeline, there will be like 5, 6, even 10 people surrounding them that are put at high risk. And if the person that put at high risk is medical personnel, it means they have to be in self-quarantine, and then the one that's not in quarantine have to work like 2 times, 3 times hard more to take care of the patients.
So basically, they have to deal with the workload to cover those who have to be in quarantine because they've been in close contact with those who concealed their timelines. We have to say whether it's deliberate or not, it has put on a very huge effect. So many of the authorities have been urging those they have to reveal their timelines for the sake of controlling the disease. And especially that the COVID-19 situation is getting worse, many of the authorities, even the CCSA, has urged them to reveal their timelines. So it's for the benefit of others as well.